I've probably seen just as much as everyone else when it comes to social media, the back and forth about whether we should go out or stay home. And really taking that all in takes a toll on our mental health. So joining me to talk through all of this is Dr. Brad Schwall, CEO of the Center for Integrative Counseling. Hi, Dr. Schwall.
Hi there, good to see you.
Yeah, likewise. So first of all, I just, a lot of people, I want to tackle this, head on. A lot of people feel strongly about what they should do today and frankly what others should do, right? So how do you suggest that we absorb this and sort of then move on?
Sure. Well, we are seemingly feeling more relieved that we are overcoming what is happening, yet we still need to be careful, and there's a lot of anxiety now about the unknown. How much? What can I do? So there still is that sense of concern, even as things are reopening. And I am thinking of teenagers and the impact that it's having on the end of school year and upcoming camps. That not knowing is difficult.
Yeah, and how do you cultivate patience when it comes to a mental health realm? I talk about this a lot with my yoga students, but I think it's just a difficult concept, and it's one that we've really got to be all practicing right now because this is a fluid and evolving situation, and there is so much uncertainty in the unknown, like you said.
Most definitely. It is important to recognize that our circumstances do have an impact on our mental health. Mental health is a physical issue, but our circumstances and that unknown does lead to anxiety. Problem solving is a key to well-being and mental health. So we are having to problem solve. I was talking to a teen the other day, and Ella was talking about missing those end of school year milestones. We can help our teenagers find new ways to celebrate these milestones and prepare for what is to happen. And I always do say, focus on the moment still. What is the next thing we can do? Everything won't be normal all of a sudden. So what is the next thing we can do?
Yeah, certainly. It's sort of like one thing at a time, right? And then
Correct.
When you say that you were talking to this teen, was this over like telehealth, telemental health?
Absolutely. Well, yes. So certainly the center is using telecounseling. She actually was a contact, not a professional contact. But we are working with teens in counseling, and they are open to it. They are talking with us. They are sharing, even children. So it has been working where we are saying to people, take care of your mental health. There are going to be other anxieties. The financial impact of this will continue to be impacting our lives, and that leads to stress. Also, we've had to recalibrate during this time. So it is so important to talk about mental health, to be open to getting help.
To talk about it, meaning like it's okay to post about how you feel on Facebook like every day?
Every day,
yeah.
Yes. Well,
okay.
Yeah, I do think it is helpful because, for example, when I read your posts and when I read others, it is helpful to hear how people are experiencing the situation. So by sharing and by listening, we can learn from each other. And that ability to talk about our feelings, talk about what's happening, really can be cathartic and helpful.
Something else I do need to ask you about that you and I have briefly spoken about is grieving the loss of loved ones when we can't gather for services. I'm attending my first virtual funeral or memorial service tomorrow morning for a colleague who died, a former colleague of mine. And so I'm just wondering, are people talking with you guys about this? The not being able to be there and give people hugs and, look at people in the face and feel their presence. I don't really know how to deal with this myself.
Yes, definitely. Our therapists are hearing that, and it's impacting our staff. And so when I think about you, I am thinking about ways that we can interact, express our emotions. So finding those ways to have those times together, even though it might be virtual. Writing, I believe, is also very helpful and can be therapeutic. So finding the best way that we can to grieve, Even though we're physically distant, doesn't mean that we can't be reaching out and finding ways to talk, to remember the person whom we've lost and share positive memories about them. And then also look to the future. Look to when we can gather more and when we can get together and have a time then where we can express some grief and seek community.
Yeah, I've really enjoyed the journaling, like you mentioned, writing a lot, and just using this opportunity to reflect. So, Dr.
Definitely.
Schwal, thank you so much. As always, we really appreciate it.
Thank you. Take care.
You too.